Welcome to the Veterinary Rehabilitation Podcast, where we aim to help fellow veterinary rehab therapists increase their knowledge and elevate their practice. I'm Megan Kelly.
And I'm Ané Lloyd. Together, we bring you the latest insights, research, and information in the field of veterinary rehabilitation.
This podcast is brought to you by Onlinepethealth, a leading continuing education membership for veterinary rehabilitation therapists. With Onlinepethealth, you'll have access to a wide range of online resources to help you stay up to date with the latest techniques, advances, and trends in the industry.
Our podcast features in-depth conversations with leading experts in veterinary rehabilitation. They share their own experiences and knowledge to help you improve your practice. Whether you're a seasoned pro or just starting out in the field, our goal is to provide you with the tools and the insights you need to succeed.
So join us as we explore the exciting world of veterinary rehabilitation and help you take your practice to the next level. Hey veterinary habbers, in this episode, which is a revisit to one of our membership research refreshes, Ané Lloyd explores the crucial role of strengthening and managing canine osteoarthritis. Now, there are striking parallels between human and canine osteoarthritis, particularly when it comes to the benefits of strength-based intervention. With a strong focus on knee and hip osteoarthritis, this episode reviews key findings from human research and how they can inform and enhance treatment strategies for our canine patients. Now, if you're looking for continuing education, we have got you covered. Our small animal webinars next month will be utilizing gait and movement technology in rehabilitation therapy practice and common sports injuries in dogs, and both of these are by Ariel Pichette-Markley. Our Hydro webinar is incorporating training skills into canine rehabilitation by Milka Turu, and our equine webinars are structure and function of the equine musculoskeletal system with Constanza Gomez-Alvarez, and poor performance linked to the mare reproductive system by Margaret. So you can go to www.onlinepethealth.com/free to register for these webinars. Now, a quick word from our sponsor before we dive in. At Paw Prosper, we believe true pet well-being demands a three-pronged approach: prevention, support, and rehabilitation. Our brands are trusted by veterinarians, universities, and rehab facilities alike. So whether you are looking to train, rehabilitate, or help your patients age gracefully, our brands Walking Pets, Help 'em Up, Response System, Fit Paws, Muffins Halo, Sleepy Pod, and Canine Carts offer effective, innovative, and proven solutions. So you can sign up today to receive a one-time special gift for all our Onlinepethealth veterinary rehabilitation podcast listeners with your next order. You can sign up using this special link, pawprosper.com/OPH. Right, over to the research refresh with Ané.
Good morning, veterinary habbers, and welcome to this month's research refresh. We are diving into the role of strengthening in the management of canine osteoarthritis, a 2021 publication by Marty Drum, Emily McKay, David Levine, and Dennis Marcellin Little. Okay, so we know that osteoarthritis is highly prevalent. In fact, it is occurring in 1 out of 4 dogs, so 20% of dogs that are over 1 year old, and in about 80% of dogs over 8. And when we draw a parallel to people, which we will be doing a lot in this article, then we know that in people, about 25% of Americans have OA, and 80% of people over 55 have symptomatic osteoarthritis. So very comparable statistics. We can also draw a parallel between the high prevalence of knee and hip osteoarthritis in both people and canines. Now, the ORSI, or the Osteoarthritis Research Society International, for knee OA, they recommend that land-based exercise, strength training, weight management, water-based exercise, self-management, and education all form a part of the core management of osteoarthritis, the core treatments for OA. It can be challenging to perform the same or equivalent exercises in canine patients when we're talking about strengthening exercises and comparing that research from the human industry, especially when we're talking about push-pull training, powerlifting, explosive dynamic training, and muscular isolation exercises. However, it's not impossible. There are many things that we can do with our canine patients, and there are a lot of things that we can take from the human research. So in this paper, they demonstrate quite a few, or they demonstrate some exercises visually. And for example, here they're showing the use of exercise equipment to strengthen the lateral forelimb and shoulder extensor muscles. It's a really nice little exercise. So when we're specifically considering canine strengthening, there have been studies looking at muscle activity during specific strengthening exercises in canines, but none have specifically looked at osteoarthritis and which exercises are effective at improving osteoarthritis symptoms. What is really exciting is that there is a close comparison or association between human OA and canine OA, and so we can use spontaneous OA in canines as a preclinical model for human OA, and we can use human studies and translate them to the canine treatment or our clinical decisions around treating OA in canines. If we look at a 2011 meta-analysis that Orsi evaluated, then what they found is that in lower limb and quadriceps resistance training for knee OA, there was improvements in pain control and functional mobility. Land-based exercise provides 2 to 6 months of pain relief, equivalent to the use of NSAIDs, and that's really important. So we're getting a similar outcome as when we're using non-steroidal drugs. Great improvements were seen when more than 12 training sessions were face-to-face, and that's really important as well. So exercise is giving us a similar effect to non-steroidals over a 2 to 6 month period, and the greatest improvement can be seen when more sessions are face-to-face, more than 12 sessions, so we're looking at long-term programs. Okay, a Cochrane review looked at strength exercise, and it yielded improvements in the WOMAC pain and functional score. What was really interesting from that study is that they found this relationship between pain and movement. So although patients knew that movement was beneficial, they also experienced pain and were afraid that movement would result in more pain or would cause damage or harm to those joints. For that reason, they avoid movement, and that results in greater pain and stiffness and muscle atrophy, etc. And so this cycle occurs. And this is highly relevant to our canine patients because they are primarily referred to us because of lameness, a decrease in mobility, and a reluctance to walk. I'll come back here so you can have a quick look at these images. So again, just highlighting the use of equipment, canine fitness equipment used to strengthen the hind and forelimb muscles. Okay, so this relationship between the experience of pain and then the reduction in exercise, that does absolutely translate to the owner and their experience as well. So what happens is that the owners will reduce activity with the exact same fear that they're going to be causing harm, and as a result progressing that arthritis, or at least not supporting the body in the way that is necessary. Okay, importantly from that Crane review as well is that the length of treatment, the length of exercise programs needed to be between 35 and 45 weeks for maximum benefits to be achieved. And again, as we educate our owners, that is really important because we're not looking at a short-term rehabilitation program, we're looking at a lifetime management of the patient. So if we think about duration of exercise in canines, we don't specifically have papers that look at OA and exercise, but in a study with Labradors that have hip dysplasia, they did find that daily exercise for more than 60 minutes was superior to daily exercise for less than 20 minutes, regardless of what that exercise type was. And so to highlight, it's imperative that we communicate to clients that a lengthy treatment period is needed or an indefinite treatment period to achieve and continue to achieve positive outcomes for OA patients. If we look at strength and aerobic activity, exercise and weight loss are both essential pieces in the OA puzzle and go hand in hand. And so in a meta-analysis, let me just find that. So in a meta-analysis of 3 times weekly strength training with or without aerobic activity for knee OA, they found that both exercise programs were effective in controlling pain and in the short term. And then 8 studies were included in this. All of them showed an improvement in the pain scores. Non-weight bearing exercise had the greatest treatment effect. If we look at resistance training and OA, a meta-analysis was performed where they looked at older adults performing lower limb progressive resistance training. They found a moderate effect in lower limb strength and pain. The treatment effect in the older an individual was, the larger the treatment effect was. So there could be that correlation between age and weakness, age and OA, and how that relationship can definitely be explored more deeply. Comparing high intensity and low intensity exercise, both had positive outcomes, both improved pain and function, and then comparing dynamic versus isometric programs with resistance bands, both are beneficial for function and pain. And so importantly, there isn't one single type of strength training that is superior to others, as long as it provides progressive overload and the intensity is adjusted to the patient tolerance. Okay, now a few studies, while none have looked at canine OA and exercise, there have been a few studies that look at therapeutic exercises in dogs and the muscle activation that's occurring. So they mention here a sit-to-stand exercise, a sit-to-stand study. This is a commonly prescribed exercise for hip strengthening to encourage activation of the quadriceps and gluteals. A kinematic evaluation shows that hip extension is decreased during the sit-to-stand exercise. So if we think about HD, or hip dysplasia, we know that reduces hip extension and that hip extension becomes painful. So potentially performing this exercise will strengthen that hamstring and quadriceps without putting additional stress on the extension of the hip joint. So how does that affect, functional hip extension? No studies have evaluated whether hip extension can be improved with the sit-to-stand exercises. All right, and then these visuals here, we can see, the wide sit of the dog, the wide foot placement, and into stand, and that's when that foot placement is wide, there's additional rotation that's occurring from the hip down. And so they highlight that the proper posture is really important to have the correct muscle activation, especially for this exercise. And this is one of the ways that we can support that correct posture. Looking at aquatic therapy. So hydrotherapy is considered a safe and effective treatment for knee OA in humans. In a randomized controlled clinical trial over a 12-week period, aquatic therapy improved knee and hip flexibility, strength, and aerobic fitness. Now, if we consider, so by incorporating the hydrodynamic principles and prescribing the appropriate amount of loading, aquatic exercise can be a successful treatment option in small animals with OA as well. Absolutely. So the principles of aquatic therapy, I'm not going to go through this with you, but there are a few points that really stood out for me that I do want to share. So in terms of buoyancy, movement in water has been reported to be easier and less painful than on land. Perfect. We know that load and limb resistance depends on the depth of the water. So if we're thinking about underwater treadmill, that water depth is really important. Okay, and then focusing solely on the reduction of pain without muscle strengthening would do a disservice to the patient. Overall muscle strengthening leads to increased joint stability, which results in decreased pain. So really important. In terms of hydrostatic pressure, this can provide increased non-noxious sensory input, which results in a decreased pain sensation, which I think is very worth remembering. And then here we just have an example of an arthritic patient exercised in an underwater treadmill at different water depths. With insufficient buoyancy, the top line is sloping, and with deeper water, the dog's posture is correct and its comfort increases in the water. So non-surgical management for dogs diagnosed with OA is really centered on improving muscle strength, endurance, cardiac function, and coordination. Low impact exercise, preferably through multiple shorter sessions instead of one long treatment session, is beneficial, and reducing the amount of weight that the dog must support during exercise allows for safe functional movement with a reduction in pain. The question is always swimming versus underwater treadmill, and they, conclude and share that really that decision is dependent on your treatment goals and on the patient. So in summary, although there is little evidence specific to dogs regarding strengthening exercise for the management of OA, there is a substantial body of evidence in the human industry that consistently supports the value of strength training for OA treatment. Regular exercise should be considered a core treatment strategy for the management of OA in dogs. The improved muscular strength from resistance, aerobic, and aquatic therapy can help protect the arthritic joint and improve pain and function in the short and the long term. It's imperative that owner education focuses on the importance of exercise for management of all animals suffering from OA, even for the management of early and mild cases. So their clinical care points summary: exercise can help control the pain of osteoarthritis and improve functional scores regardless of the type of exercise. Benefits from strengthening exercise can be seen in the short term, 3 months, and in the long term, 12 months. After completion of an exercise program. Positive effects from exercise may require a long duration of engagement in the program, up to 35 weeks, before improvement may be apparent, but exercise can have long-lasting benefits. Aquatic exercise may be initially easier than land exercise for an arthritic patient, but targeted strengthening exercises on dry land are also important to control pain and improve function. All right, and with that is our research refresh for this month.
If you enjoyed this podcast, please hit the subscribe button so you get notified every time I load a new podcast. I'm here every week talking to vet rehab therapists from all over the world about all things vet rehab. A big thanks to our sponsor, Paw Prosper. Their sponsorship allows us to be able to give this podcast to you for free, so please go and check them out at pawprosper.com. Don't forget to bookmark the next Vet Rehab Summit on Saturday, the 8th of November, 2025. Come and be a part of the world's largest online veterinary rehabilitation conference created specifically for you, the vet rehabber community. Onlinepethealth members get VIP complimentary access to the Vet Rehab Summit. For more information about continuing education for vet rehabbers, you can go to onlinepethealth.com.